Good morning. It is Tuesday, September 13th. So glad you're with us today. I'm Jessica Lovell.
And now I'm up for a stem cell or bone marrow transplant. It is really looking favorable to a long-term cure.
A man's germ-fighting network under attack by cancer. He was diagnosed with lymphoma. Now his own stem cells help save his life. Plus, with inflation taking its toll on us in many ways, the program making it more affordable to get to your medical appointments. And of course, Dr. Hodgkinson will be with us today with our COVID count and answer some of your COVID-19 questions. We know you've got many of those. Thank you again for joining us on Facebook, YouTube, and on Twitter. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio. Vince Syward was diagnosed with stage 4 lymphoma, but the type of lymphoma you have really affects your treatment options and your prognosis. Vince joins us live this morning with how he is doing post-treatment. Plus, we are joined in studio this morning by one of Vince's doctors, Dr. Nasheen Ahmed, who works in hematology and medical oncology. Good morning to both of you today. How are you?
Good. Good morning.
Good morning. You two are kind of reunited this morning. How long has it been since you've seen Vince?
Yeah, just a few months, Vince. It's been a few months.
Yeah. Well, we will have a reunion of sorts and share your story in a moment. But in the meantime, we know you have a lot of questions from cancer to COVID. So get those sent into us on social media or via email. You can find links to those right there on your screen. Non-Hodgkin's lymphoma is one of the most common cancers in the United States. The American Cancer Society estimates more than 80,000 people will receive a diagnosis in 2022. According to the website bmtinfonet.org, more than 50,000 people, though, worldwide undergo a blood stem cell transplant each year. Non-Hodgkin's lymphoma is different, though, from other blood cancers. Unlike leukemia, which grows in the blood-forming cells inside bone marrow, lymphoma originates in the lymphocytes, which fight infection. And for patient Vince, cancer has been a part of his family for years, but not in the way you might think. Alexis Del Cid has that story.
I'm originally from a small town called Walnut, Kansas, which is about 30 miles west of where I live in Pittsburgh.
67-year-old Vince Syward was just settling into his golden years and enjoying retirement when he got the stunning diagnosis. He had stage 4 lymphoma, and it was in his bone marrow. And how he discovered it was almost accidental.
All my tests, yearly physical came back great. And just in passing, I'm friends with the doctor. Our kids went to school together. And I mentioned that, am I supposed to have an extra rib on this side? And he went over and felt it. And then he's like, no, that's not normal.
Within 2 weeks of the diagnosis, he was here at the University of Kansas Cancer Center prepping for his first round of chemo. And on this day, he considers himself incredibly fortunate.
And now I'm up for a bone marrow transplant, which is really looking favorable to a long-term cure. So I'm kind of excited about that.
For Vince and his family, though, it's come full circle. Years ago, his youngest son, a K-State student at the time, signed up to be a potential bone marrow donor on a whim.
They went over and swabbed his cheek. Well, it wasn't 3 months later. He was home for Christmas, got a call that he was selected as a match.
So his son flew to San Antonio, Texas to donate his marrow, saving someone's life in the process.
It was kind of interesting that here I am 8 years later, getting a similar transplant.
Today, the father of 2 says he's looking forward to the future with so much to live for.
3 more hours, about. Yay!
And so many more years to look forward to.
We've had a good life, and I've just got a lot of living to do yet.
Vince, you sure do. And you are joining us this morning from Pittsburgh, Kansas. We were visiting a little before the show. We've got a connection down there. I said a lot of my family's from in and around the Pittsburgh, so I kind of knew you were my kind of people. So nice to have you with us today alongside Dr. Ahmed. Vince, how are you feeling today, and where are you in your treatment process?
Feeling really good. I've been able to get out and walk 2 to 3 miles a day, and then trying to work on exercise program. Still a little, energy-wise, I'm still a little draggy, but other than that, a good outcome.
Day by day, doctor, is he being a good patient by getting out and doing the exercises? Is he doing everything right?
Exactly. That's what we want. We want people to get back to their normal routine, get back to what life is for them. And Vince has been very active even before the transplant, so I'm glad to hear that you're getting back to some of those routine activities.
Getting back to life. Vince, what was it like when you first heard the news that you had lymphoma?
Boy, that's a real shock. I mean, you just kind of don't believe it at first, but KU was great. They got me in so quick that didn't have a lot of time to dwell on it, so that helped a lot.
Vince, if you're like me or like a lot of people, I had never heard of CAR T therapy. What had you heard about that?
Other than my son being a bone marrow donor, you know, that was about all I knew about it.
Well, that's like a lot of us, learning day by day when we hear these type of diagnoses and trying to find out what kind of treatments are available. Dr. Ahmed, CAR T therapy can be an option for lymphoma. What is the difference, though, between autologous stem cell transplant, which Vince got, and then an allogenic transplant or CAR T therapy? So tell us a little bit of the difference between the two.
Yeah, Jessica. So, these are terms which many people hear for the first time, and it is, I just wanted to shed some light on what these things mean. So, an autologous stem cell transplant is just a fancy term where we use stem cells from the patient's own body. So we don't need a donor for that, and that's what we did for you in your particular case. So the whole purpose in an autologous stem cell transplant, it's also called a bone marrow transplant, it's also called a stem cell transplant. The whole purpose is that we are able to administer chemotherapy, but we know that chemotherapy can affect your stem cells and destroy your stem cells. So we take some healthy stem cells from the patient's body or and store them in a freezer. And then once we're done with the chemo, we infuse those cells back. And that way it helps to get the body back strong again and get you to recover from the transplant. That is what an autologous stem cell transplant is. It's kind of like when you do lawn care and you want to get rid of weed, in the back of the grass, weed in the back of the lawn. Then you don't just pluck the weeds individually. You want to get rid of the whole thing, just the good grass, the weed, everything. But you want to save some seeds of the good grass so that later on, once everything's gone, then you can just plant the good grass back in.
And it's your own grass.
And it's your own grass, and it'll just grow back again.
Now, you've explained it in terms that we can understand. Thank you very much.
So. Yeah, yes, I know these are very difficult concepts to understand, and it does take a while to. But this is the best analogy I can give.
No, that was fantastic. A lot of big words, a lot to try to understand when it comes to our health. And again, those treatment options that change so frequently and they advance so quick. So Vince, what were some of the symptoms that you were having? Share with our audience what you knew to come and see a doctor and get help right away.
Well, I absolutely had no symptoms. I was pretty active and still working full time. Like I told them earlier, being friends with the doctor, we were done with the yearly physical, and I just kind of mentioned that I had this kind of a lump on one side, and it turned out to be my spleen was enlarged. And by finding that when we did, I imagine it saved my life.
Yeah, I bet so. Is that typical, though, not to have a feeling sick, maybe just something protruding or something you're noticing on your body? Or could it be anything?
Yeah, that's true, Jessica. With Vince, luckily he didn't have any symptoms. Some people have, many symptoms and need to go to the doctor, need to go sometimes even to the emergency room. But then there are cases, like in your case, Vince, where there may be very minimal symptoms, maybe no symptoms at all. I mean, I remember you came to me and you were like, if the scans didn't show it, I wouldn't even know that I'm sick.
And that can be scary, not having those symptoms or signs, and you can miss something and then it goes too far.
Exactly. So I'm glad that, you found it. We found it when we did, and then it was taken care of the way it was in your case.
Two types of lymphoma. Can you describe the difference?
Yeah, so just broadly speaking, we have a Hodgkin's lymphoma and a non-Hodgkin's lymphoma. Those are both, those are both kind of determined based on what the pathologist finds in the type of the blood cells that are involved in the cancer. And they have some differences, like Hodgkin's lymphoma can affect younger people more. And with non-Hodgkin's, I mean, there's a non-Hodgkin's lymphoma is like a basket term for many different types of lymphomas, some of which can be very slow growing, some of which can be a little more fast growing. Those are the main differences.
So what's the long-term follow-up for patients like Vince look like? Are you two going to see each other often? How is that going to work?
Yeah, so we, in the first year we do several scans because initially we want to make sure, see that the disease is still at bay and there's no new issues that are coming up. In the long term, even though, as time goes on, the chances of the lymphoma coming back get lower and lower. But in the long term, we also focus on well-being and what we call survivorship. Which is very important in all our patients who've had any kind of transplant, whether it's an autologous, allogeneic, or even CAR T-cell therapy. And that is where we look for late toxicities, any specialized follow-up or individualized follow-up plan that we can share with your primary care doctor. That's our focus.
I do want to mention you are the medical director of our transplant survivorship program. Why is that so necessary to have? And is somebody like Vince automatically in the program once he finishes his treatment?
Yes, that's our hope. We have this program established since 2016. We have a handful of transplant programs across the nation that have a dedicated survivorship program. We've noticed that our survivors, those that, we're talking people who've had cancer, had transplant 5 or 10 years ago, we've noticed that there are many things that we can help with. There's, things like bone health, cardiovascular health, infection risk, other things that may be different from the general population, and they may need more specialized or individualized care plans. We have seen that interventions, and this is studied, and there are papers on this, that interventions can actually improve the life expectancy and therefore the importance of being in a survivorship program, making sure that we are able to coordinate your care, not just across transplant, but across, with your local oncologist, with your primary care physician, make sure that nothing's, missed or no oversight on your care.
Let's futurize a bit and talk about future therapies, any clinical trials that are going on. What's on the horizon? I wanted to bring up CAR T-cell therapy before I talk about clinical trials. So CAR T-cell therapy has kind of literally revolutionized care in lymphoma. It's a paradigm shift that's been FDA approved. The first CAR T-cell therapies for lymphoma have been approved in 2017. And in the last 6 years, we've been able to offer this to many of our patients who need it. And Vince did not need it, but this is an option out there. It uses the body's own immune system because we believe that now lymphoma or any other blood cancers grow because those cancer cells have blinded your immune system, and your immune system cannot see them and fight them. So we use your body's immune system, your soldiers, your T cells that are in your blood, take them out, genetically modify those cells, and make them now more able to see the cancer. And then infuse those back, and then they go and they work like Pac-Man, go and destroy the cancer cells. Yeah, I love the Pac-Man analogy.
I know.
They just go and eat them up right down the line.
Exactly, just go eat them up. And so we have clinical trials. We have clinical trials even in follicular lymphoma, which Vince had, and in other lymphomas, try to see if we can get this up front, see if, in earlier instead of waiting till, a later line of therapy. As well as we're getting this in other different types of lymphomas. So in the last several years, we've had 3 products that have been approved in high-grade lymphomas. We've also had approvals in follicular lymphoma, mantle cell lymphoma. This is a very promising therapy that's still evolving and continues to evolve as the landscape of lymphoma therapy evolves. So clinical trials that we have involve CAR T-cell therapy. We also have clinical trials with some novel agents, and this is more in patients that may not respond to traditional chemotherapy. So, so we would definitely encourage all our patients and caregivers to look into clinical trials and see if anything would be suitable for them.
Let's take a slight economic turn. Vince, I want to ask you, I know the health system has a gas card program here that you participated in. Tell us a little bit about that allowed you to get to your appointments. You're down in Pittsburgh, and we don't want people to miss out on great treatments that they need due to that. And certainly due to inflation and the pain at the pump. So how did you find out about that, and how helpful was it?
Well, part of KU's program covers people that help you with other issues, and they brought this gas card program up, and obviously running back and forth to Pittsburgh, which is about 200 miles, that really helped a lot. So I was really grateful that they came up with those cards, and he just used them like a credit card at one of the, I think it was Quick Trip gas stations, and it really helped out.
I would imagine. How many times were you coming back and forth from here in Pitt?
Ooh, about once a week for several months. I mean, 6 months at least. So
yeah.
It was a lot of trips.
That definitely adds up. All right, we're going to get back with Vince and Dr. Ahmed in just a moment, but let's turn to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count.
Yeah.
Good morning. How are you?
I'm good.
Good.
31 active patients right now in the health system, with 8 in the ICU, 3 on the ventilator, still 19 in that recovery period. Unclear exactly why we've kind of gone up despite the couple-week trend of overall cases going down and hospitalizations going down. So again, we're looking into that and just seeing how many people are fully here due to COVID symptoms themselves and what their vaccination status is. So.
Okay, you remember yesterday we had several COVID questions for you that I was unable to get to, so I promised I'd get to them today.
Yeah.
So I want to get to Kathy's question. She wants to know, if you put off getting your second booster and got the new one this week, is another shot needed, and how long?
Yeah, so this is a really good question. I think a lot of people are going to have these questions about boosters. You know, if you listen to the administration, the CDC was able to hear an interview with Dr. Anish Jha, who heads the administration's COVID task force. You know, what they're saying is, again, if you remember, people who are 50 and under 50 really haven't had any other boosters. There was no recommendation for boosters, so most of those people really haven't been given a dose of vaccine probably since last summer or last fall. Moving forward, what it really does look like is that there will just be a yearly recommendation for that COVID booster at this point in time, because we know, number one, people have probably been vaccinated, boosted before. Now they're getting this newest updated booster. In addition, there's been infection as well, so that all of that tends to increase your immune response. So right now, what it is looking like is that if you have received a booster, and especially if you've received one of these new boosters, there probably will not be a recommendation for an additional dose, probably for another year. Now, that is the caveat of if you have significant comorbidities such as immune suppression or age, there may be recommendations coming down, say, for getting another booster in 6 to 8 months. But at this point in time, really, it's just getting this newest updated booster, and then you will probably be good for the rest of the year until next year. There is no other recommendation for further boosting at this point in time.
Jean wants to know, have medical experts resolved the issue of whether or not to take Moderna bivalent booster after having all previous shots from Pfizer? Can you mix and match? We get that question a lot.
Yeah, I mean, the simple answer to that is yes, absolutely, you can mix and match. They're the same platform. They're essentially the same vaccine. There are discrete differences between them, but you are able to mix and match, and that should be totally appropriate.
Joellen says she has seen conflicting information about when to receive flu vaccine. What's the best time for her to receive it? She's over 70.
Yeah, another good question. So again, the CDC recommendations is never miss an opportunity to vaccinate. You know, that being said, there are details in there, and there are just other points that we need to make. Number one, right now we know and understand that influenza activity in the United States is very low. We know that there is no recommendation for a second influenza dose during the influenza season. It's only that one. And so do you want to push that dose out maybe to late October or November? That will give you 6 months of essential highest grade immunity against influenza when we start to see an increase in the rates of activity of influenza. So again, CDC recommendation is never miss an opportunity to vaccinate. However, if you take into account the overall activity of influenza right now and understanding that you're going to need that immunity through probably April, it certainly is reasonable if you judge your own risk to be able to push that vaccine off maybe until late October, early November.
The health system is going to start administering
And
booster, is that right?
yeah, and I would like to say you can receive influenza vaccine and COVID vaccine at the same visit as well. We are expecting our updated COVID booster to be in tomorrow, September 14th. At that point, we'll be able to be given those.
And there's some information there below on your screen. Doc Hawk, thanks so much.
Yeah.
Do we have any reporter questions on the line today? All right. Let's get to the community. Suzanne says she read somewhere, doctor, that non-Hodgkin's lymphoma can lead to eye cancer. Is that true? Have you heard that or read that?
So that may be in very rare cases, but I haven't really come across that.
Okay, so also, I've heard that Crohn's disease increase. Jennifer wants to know, it increases the risk of getting Hodgkin's lymphoma. Can you tell us more about that? Any connection between Crohn's and lymphoma?
Yeah, so any kind of inflammatory autoimmune process can be associated with an increased risk of lymphoma, Hodgkin's lymphoma, or other lymphoma. So I would just consult with your doctor about if there's any new symptoms that you come across, or continue with the screening guidelines as based on the specific disease characteristics for the Crohn's.
Vince, what are you looking forward to getting back to the most?
Oh, being able to see family again.
Have you had to stay clear? And how has it been for you with COVID still here? What has that been like for you?
Well, I'm fortunate. My wife is retired, so she shops for groceries early in the morning. I'm still supposed to be isolating from people and crowds. So I did have a close friend come up from Texas about a week ago, but we sat outside and distance. But really be back to hugging the boys.
I bet, I bet. It's the little things that we take for granted, right, Vince?
Yeah.
Well, you're going to hug those boys really soon, okay?
Yep.
I know. Doctor, what?
Start getting all the shots up to date.
Good. Doctor, what has it been like, though, for people like Vince? I know it's an emotional time. For many of us who, again, take for granted that we feel, so many people feel COVID's kind of just a thing around us. But for people like Vince, I mean, they're living with this every day and face that risk.
Yeah, yes. And after a transplant, the risk is higher. Your immune system is down for a while, and we advise COVID vaccinations around day 100, so around 3 months after the transplant. And until then, we do ask. I know Vince has been behaving.
Yeah, he's
for sure. And it takes a toll on you. But thank you, Vince. But yeah, we ask for isolation, kind of staying in a bubble as much as possible, and that's asking a lot. But it's just for just to make sure that you're safe and you're able to. You've been through such a lot of treatment, and we want to make sure that now we kind of maintain your health from there.
He's come this far.
Exactly.
But it's hard to ask someone, doctor, who's going through something like this to not hug their babies, and be around family. They really need that support. I always think that's got to be, just that mental, human connection is so much part of healing.
Exactly. And then we always say that, just look at the big picture. I mean, we want you to be able to hug your babies and be with your family for years and years from now. So, this is a little sacrifice that we do ask of you, and it's a lot, but, just I always tell you to focus on the big picture. So
you promise your doctor's order to Vince soon will be to hug the boys, right?
Exactly. We'll get there.
You're going to get there. Don't you worry, Vince. A couple questions I just want to get to before we get to our final thoughts. Yen Liang, what are the early stage clinical symptoms that a patient with lymphoma cancer may have. We talked about that a little earlier in the show. Could you just go over that for folks?
Yeah, so some of the symptoms, so as we said, you may not, like Vince, have any symptoms at all, or you may feel a lump that's persistent. There are some symptoms such as unexpected weight loss or feeling more, just unusually fatigued, and it's persistent, and it's just, there's no explanation for it. Night sweats, fever that's been there and there's no explanation for it. Of course, you've checked with your doctor and all. Those are some symptoms where we start looking for lymphoma.
Kim wants to know, is there a difference between bone cancer and bone marrow cancer? She says, I have cancer in the bone marrow. She's waiting for some labs to get back from us, but so thank you for sharing your story, Kim. But is there a difference between the two, and what is it?
Yeah, so bone and bone marrow are two different organs. The bone marrow sits inside some of our bones, but when you have a bone marrow cancer, we're typically talking about things like leukemia or other bone marrow disorder related things.
So it's just kind of called a different name.
Lymphoma. Now, bone cancer, it could be cancer that starts in the bones or cancer that is spread to the bones from somewhere else. So those are slightly different terminology, yeah.
Well, this has been a great conversation, and so nice to have you on with us, Vince. We're going to get to our final thoughts, and I'm going to let you start with us, my friend. Just what do you want us to know, and just your final message?
Well, obviously, if you have any symptoms, don't ignore them. Bring it up to the doctor. Sometimes a simple question will really bring out a problem. And I just want to thank everybody up there at KU. They're a great team.
Well, thank you for joining us today, and thanks for being such a good patient. I know Dr. Ahmed appreciates it because that means that you're going to be healthy and safe and getting back to life. So Vince, we will see you soon, okay?
Thank you.
Thank you. It must be nice to see your
to
see these folks just making their way out of that darkness and knowing that you're going to see them up here and being healthy. What's your final thought? What have I asked you, and what do you want us to know?
So first of all, I wanted to also congratulate you, Vince, for being the proud father of a stem cell donor, because that's something that this is a voluntary procedure to help save someone's life. It's a huge deal. So that's just, I wanted to make sure that we acknowledge that. And then my other thoughts, my final thoughts are that don't be afraid to ask about curative therapies. Some of these curative therapies, like CAR T-cell therapies or transplant, they are offered at specialized centers, and it may sound overwhelming, or it may sound like something that one may not be interested in, but these are curative options, and we should always ask your doctor about whether this would be the right treatment for you, and whether you should be referred for such therapies.
Doctor, thank you so much this morning for your insight. And yes,
Thank
Vince,
you.
tell your son thank you for being the match. Thank you so much. Dr. Hodgkinson, your final thoughts today.
Yeah, I think, again, good questions. And I think we will just see more of these questions. Just a quick and dirty details about the boosters. Certainly, if you are 12 and over, you are eligible for this next round of boosters. Again, most people under 50 have probably not received a dose of vaccine since last summer or fall, so you are good to go on that. But if you have had COVID recently, it is certainly reasonable to wait, say 60 days, 90 days before getting that next dose.
All right, and we're going to give more details and talk more about
Yep.
that tomorrow on Open Mics with Dr. Seitz. President Biden says his cancer moonshot program will reduce cancer deaths by 50% in just 25 years. The Coalition for Health Advances and Research Foundation says cancer deaths have fallen already 27% since 1999. President Biden outlining the updates to his cancer moonshot program at the JFK Presidential Library in Massachusetts yesterday. Here he is. The goal is to rally the nation around developing treatments and therapies for cancer. He issued an executive order establishing a biotechnology and biomanufacturing initiative intended to position the U.S. as a leader in the field and to center drug manufacturing in the country. And he named the first director of the Advanced Research Projects Agency for Health. That is the new agency intended to help drive biomedical innovation that supports the health of all Americans.
To drive breakthroughs to prevent, detect, and treat diseases including cancer, Alzheimer's, diabetes, and other diseases, and enable us to live healthier lives.
President Biden also talked about a new federally backed study for using blood tests to screen against multiple cancers. Researchers call it a potential game changer in early detection of cancers. The president has taken on cancer as a major issue in his presidency after the death of his son from brain cancer back in 2015. Thank you so much for being with us today. Don't forget, you can watch our shows anytime by logging on to Facebook, YouTube, and Twitter. Go out, make it a great day, and we'll see you back here for Open Mics with Dr. Stites at 8 a.m. tomorrow.
Youth violence is a leading cause of death for young people, with lasting physical, mental, and social trauma for survivors. I'm Dr. Steve Stites. On the next Open Mics, learning how a CDC grant is working to break the cycle of violence here in the Metro to keep our kids safer and healthier. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.